55 past the hour this morning, new fallout in the fight for abortion rights after the Louisiana State House and Senate passed a bill to reclassify two popular abortion pills as controlled substances. The bill now heads to the governor's desk, where it is likely to be signed, making Louisiana the first state in the nation to include abortion pills in the same category as other highly addictive drugs. Joining us now, Dr. Kavita Patel, a former White House policy director and NBC News medical contributor. Dr. Patel, always great seeing you. If this gets signed into law, what kind of an impact is it going to have in Louisiana and really, I mean, across the nation?
Yeah, I think that we're all trying to kind of think about what the impact to the rest of the country could be. On Louisiana, just to be clear, this is already one of the strictest states with abortion access and reproductive access, period. In addition, this bill would create, I think more than anything, Jose, confusion. So there's all this kind of defensiveness on behalf of Louisiana legislators saying, don't worry, it's only intended for non-pregnant people in these very rare cases. Well, actually, what it appears to be is to be kind of scolding anybody, including doctors that prescribe this, by making it incredibly difficult to access these drugs, when, as you said, the majority of abortions that are performed are through medications like misoprostol and mifepristone, the two medications we're talking about.
Doctor, just wondering what a state is doing. I'm just thinking, like, even standing-wise, what a state is doing determining what is a controlled substance or not. What is the federal criteria for determining whether a drug is a controlled substance?
Yeah, and there are different levels of controlled substances, and the category that this would be added to is in the same level that we see a very common drug called Ativan. That's probably very familiar to viewers. And those substances specifically have this potential for habit formation or harm, neither of which has been shown in decades. Jose, let me underscore that. Decades of research for these two drugs. Never has that been a problem that these drugs create habit or could be an intentional harm through kind of erroneous prescriptions. And keep in mind that we, myself included, we're prescribing this in very limited cases when we know that we have a person who this is appropriate for. So it's not as if it's easy to get on sale somewhere without a doctor's prescription, which is incredible. And so the overall effect on access is disturbing, but the impact to confusion, which is what I think this will contribute more to, is even worse.
Yeah, I mean, the impact on patients directly.
Right. I mean, patients will read these headlines and they'll say, oh, my goodness, there must be something wrong, or it'll scare even more women into corners and into dark spaces. This is exactly the opposite of what we want to do. We want to make it very clear that these drugs are safe, that they're full, and that you can have a conversation with a healthcare professional. But Jose, that's become difficult, not just in Louisiana, but in many states around the country. And there's so much happening that women are scared. Reproductive freedom and general health care is being threatened through acts just like this. And I fully expect this to be signed into law.
Dr. Kavita Patel, I thank you so much. It's always a pleasure seeing you. Thank you.